So I'm interested primarily in public budget and finance, debt, budgeting, and this is kind of an outlier, but it has probably more direct social implications in one way or another. But this is just to say that it's not representative of my work overall. So here we're trying to see if the opioid epidemic has had any effect on local distribution of resources. And I have a colleague, Felipe Lozano-Rojas from UGA, who is more into opioids than I am in terms of research. And so you may have heard about the opioid epidemic, right? And it has been studied back and forth. The causes are well known: lax regulations and aggressive marketing, started in the 1990s. Today we have, and the consequences are very well understood. We have hundreds of thousands of deaths, and in 2020 alone, 90,000 people actually died from opioid overdose. So that has been very well studied and very well understood. The culprits have been prosecuted right now, and there are going to be implications. But what's happening at the local level is not very well understood, and local governments are directly involved in this process. They pay for police forces, or the other way of saying it, police forces are often financed through local taxes, sometimes for healthcare facilities, and local revenues are also affected, because if you have an opioid epidemic, you will likely have lower property taxes, sales will go down, income, and so on. So, but that has not been studied. And then we have an opportunity. The DEA rescheduled one of the commonly abused opioids in 2014 from Schedule 3 to Schedule 2, and what that means, they increased government oversight over the process, and it became much harder to prescribe the opioid. So there is an exogenous shock in opioid supply, and that creates an opportunity for us. We step in and we say, okay, we're going to see what happens to the finances once you have this shock in opioids. And something we have in the paper just to show that there are different types of prescribed opioids that are commonly abused: hydrocodone, oxycodone, and OxyContin. And all of these are the same. This is 2014 when the rescheduling happened. This is fourth quarter, October the 7th, I think, when it came into force. And we see that the total amount of opioids in morphine milligram equivalents went down, and it's because of that, because of hydrocodone. Everything else stays the same. So if you don't know what milligrams are, I don't know why doctors and scientists use metric system, but everyone else doesn't. Ask them. So what we did, our target was all county governments around the country. There are about 3,000 county governments. We got data for about 1,000, but we account for about 83% of the population in the country. So, and we want to compare the counties that are affected by the epidemic to those that are not affected. And the way we do that, we look at the share of all prescribed opioids in that county prior to the rescheduling, and we identified 25% with the highest share of hydrocodone. So basically those that are exposed to hydrocodone most, that becomes our treatment group. And the rest is our control group. And we try to see what happens to their finances once the hydrocodone is withdrawn. And we test the effect on their expenditures, different types of expenditures such as healthcare, police, hospitals, and welfare assistance, as well as different revenue sources. So I will save you from other estimation details, but here are the charts. So what we see is the total. Here is the rescheduled total expenditures went up. There was a statistically significant effect, and then by category, public welfare went up. And if we look at additional spending categories such as health and hospitals, health encompasses almost anything that's from US Census. Hospitals is basically capital expenditures. This is an investment into facilities. So we see that there is a spike in health spending, there is a spike in hospitals, but a gradual increase, not a spike, over a couple of years. Police not affected, corrections not affected, although there is a little uptick right here. And I'll say more about that. If we look at revenues, there is no significant effect. We see a little bit of here, but there's no significant effect on tax revenues, so basically the same. But there is an increase in total revenues, mainly attributable to IGR. So for the money coming from the outside, from the federal, state, and local governments, to this particular county increased after the reschedule. And it's mostly driven by the pre-trend, but it was a significant increase still. So, but think about this. So you're exposed to this opioid epidemic. You have an opioid, most likely have an opioid problem in the community. Then suddenly the supply of these legal prescribed opioids reduces. What can happen, people just try to get back to normal and kind of the community recovers. The literature suggests, however, that is unlikely to happen. What will happen, addictions don't just disappear. As we all know, we have all kinds of addictions, not as bad as, opioid addiction, but you have to treat them. And people, if you withdraw the legal opioids, they will switch to illicit drugs and more potent drugs, causing severe health deteriorations in the community. There are going to be law enforcement issues and so on. So this is why we would expect some kind of effect. In our case, we don't see any increase in police spending, so probably, maybe the police is managing to, maybe there is an increase in crime rate, but police are managing that with the resources they had prior to the reschedule. Maybe not. Maybe there is no increase. But there's definitely an increase in total spending from 8 to 13%. It is driven primarily by increased local spending on healthcare and hospitals, as well as public welfare. So providing treatment is what counties do, and they provide assistance because people need that. At the same time, there is no changes in revenues, but the injection of money from the outside increases, so they get external assistance. So to summarize, those counties that are exposed to opioid epidemic tend to have inflated budgets higher than the counties that are not exposed. They have higher spending on healthcare and high welfare spending. Most of these increases are funded through intergovernmental revenue. So what that means? Well, that means that once a county has a problem or a community has a problem, if you just choke up the legal supply or if you remove the actual cause of the problem, that kind of problem is not going to disappear. It's not sufficient to remove the cause once the county is exposed. What you will have to do, you will need to most likely redistribute your resources. You will need to provide, as a policymaker, additional assistance to treat the consequences. They're not going to go away. And that will most likely require additional funding that the affected communities will most likely not be able to generate. Because if they are affected, the revenues, revenue raising capacity will likely be limited. So they need to invest into health-oriented and welfare support initiatives, and they will need external support. So that's in a nutshell a year of work for you all.
Thank you. So I can bring this over, or?
Oh, sure. Every time I convert Keynote to PowerPoint, it's formatting things. Yeah, well, thanks again to all of you so much for being here. I'm Mikhail Stitt. I'm in the School of Criminal Justice in Rockefeller College. And I'm presenting today some early findings from a project with a colleague at Syracuse University with funding from Russell Sage Foundation and the Arnold Foundation through the Racial Democracy, Crime, and Justice Network. The project is still in the early stages. We're still collecting data, so I'm excited to hear any feedback or guidance anyone has to offer after I finish. Okay, so scholars are increasingly writing about this kind of new era of criminal legal reform that we're entering, in which there's a lot of interest in alternatives to punishment. I'll say more about this in a second, but groups across the political spectrum are calling for a lot more programs that can offer services or other interventions designed to help people and or change their behavior rather than just locking them up. So some of the most prevalent interventions that we're seeing called for in these policy briefs and political conversations are things like community service alternatives, drug or mental health treatment as an alternative, electronic monitoring, essentially a GPS device that goes typically on an ankle, and things like classes on parenting or anger management and things like that. But scholars still don't know a lot about how these alternatives are being used in practice or what their impacts look like. So in this project, we're looking broadly at how alternatives to punishment are shaping the operations of contemporary penalty. And as I mentioned, we're at the start of a much larger project, but so far we've completed 120 hours of courtroom observations and 50 interviews with people who have participated in these programs, alternatives, and then we've analyzed several administrative data sets that are kind of collecting data from jurisdictions around New York State. And we have several findings, a lot of findings, but what I'm going to focus on today is the insight that these alternatives don't operate as exits from the system. Often the way that they're talked about in political conversations is that they're something separate and apart, like more of a service than a punitive intervention, but that they do in fact extend the system into these programs. And then second, that these extensions are often invisible because of the way that they're applied in the system. They're not observable and they don't show up in the administrative data sets. So they end up overlooked when we're thinking about the reach and the nature of the contemporary legal system. So I'll just expand briefly on each of those findings. So first, just that these alternatives extend the punitive arm of the state in some new ways. And a few of those ways, so first the programs, and these are common across the different programs we're looking at, they require time and financial resources. So, because they're mandatory, they can't take into account the other things that people have going on in their lives. Often people will be assigned to hundreds of hours of community service. Drug treatment can often be like every single day. And so these programs can often make it hard for people to keep up with their work commitments or family responsibilities. And at the same time, there are financial resources that are involved almost always. People typically need to get their own transportation to these programs, pay for their own classes, or for treatment or fees for electronic monitoring. And so coming up with those extra resources can take a real toll on people's lives. And then the next is kind of the set of psychological costs, just the toll that programs take in terms of, so just like a lot of other forms of criminal legal supervision, the programs can involve a lot of shame and humiliation, both when people have to tell their friends or family like where they're going to spend all this time and why, and when they're in the programs themselves. So they talk a lot about being trapped inside their houses because of the electronic monitoring requirements, having to submit to drug testing while strangers watch them give urine samples, being berated by program staff in these programs, that they don't have the right to choose to leave. And they deal with a lot of stress just knowing that there's a hammer hanging over their heads, that if they don't complete all these requirements, they can face more severe punishments if they miss appointments or payments for drug tests. And then finally, there are legal costs. So if they do miss any of the requirements in these programs, they can face pretty serious punishments, including felony convictions and incarceration, which is kind of a segue into the next, into the next section that says extending invisibly. But essentially, we found that there are a few main places where these programs are being assigned in the court system that are invisible from an administrative data perspective, and mostly invisible to observers as well, because they're not they're not assigned inside the courtrooms themselves. So the first is as a condition of pretrial release. So when judges decide to let people out while they're awaiting trial or awaiting the resolution of their cases, they can set conditions that they have to meet in order to remain free. And sometimes they will set those conditions in court so you can observe what they are. But more often, and in the administrative data for New York State, it's 8 times more often that they just send someone to a pretrial services agency to set those conditions. So you can't observe the meeting that's usually then run by probation. You can't observe the meetings where the conditions are then decided and those conditions are not logged in any administrative data. It just says pretrial services agency contact. So we don't know what they're being subjected to pre-trial. The second is as a condition of case dismissal or conviction. So there are several ways in New York that judges can send people to these alternative programs pre-trial as a way of deciding their cases. So they'll ask them to enter a guilty plea on the front end and then send them to these programs. If they complete them, they're allowed to go back and withdraw the guilty plea and the charges will often be dismissed. But if they don't complete them, they've already entered a guilty plea and they've lost the chance to negotiate a plea deal or to fight their cases in court. So in our observations in Albany County so far, actually 42% of the plea hearings that we've observed have resulted in this kind of plea deal. People are entering a guilty plea, going into one of these alternative programs. But again, you don't typically hear in court what the conditions are going to be because people are then referred to typically to probation officers who will decide those conditions. And again, this is not logged in the administrative data. Some of these pretrial programs do show up, but they don't say what the conditions were that the person was subjected to, and they don't even say whether the person completed the program successfully or not. And then the third and fourth are similar to each other, probation and parole. So essentially, anyone who's on probation or parole can be sent to any of these programs as an add-on to their kind of conditions of community supervision. This can be by a judge or by a PO, but typically we're seeing it happen when probation or parole officers find that somebody's not keeping up with they've failed in some way to meet the conditions of their supervision, and so they tack it on as a sort of support, but sort of penalty. But again, those additions happen behind closed doors. They're not logged in any kind of data set. So we see a few implications emerging here. One is a form of kind of invisible net widening, which is what scholars often call the expansion of carceral power in the context of reform. The net widening here is particularly troubling because it's so hard to track or to measure or to understand like exactly where and how it could be happening. Second, the expansion of these alternatives involves some new forms of punitive control whose effects we really don't understand very well. And then finally, these programs are now becoming the criteria by which a lot of people's legal cases are being decided, but we don't really understand what those criteria are or what kinds of impacts they're having, particularly on the distribution of punishment across social groups and implications for inequality. So I will leave it there, but I'm excited about your questions, feedback on this project. Yeah.
I'm actually going to stand up because I have a hard time sitting still while I'm presenting. Maybe it'll make it easier to see. Oh, there we go. Just take a second. There we go. All right, so like Mikhail was talking about, we've sort of seen sort of a decline in imprisonment use in the United States, and that's what my presentation is going to be about today. I also have two co-authors at the University of Wisconsin-Madison that I should thank, Mike Pizzoli and Mike White. So you might be familiar with this term, mass incarceration, which refers to the 700% increase in the number of prisoners in the United States who were disproportionately black men, people of color in general, but particularly black men. So this massive sort of rise in imprisonment from the 1970s through the early 2000s. Some of the most important and influential work coming out of this research around mass incarceration was on the lifetime risk of going to prison. And one particular estimate that's gotten a lot of attention is this estimate that 1 in 3 black men who were born in 2001 would be imprisoned at some point in their life. And this is an estimate from an official report from the Bureau of Justice Statistics in 2003. And so this is actually one of the cohorts I'm going to be looking at today and reevaluating, because these people who were born in 2001 actually just turned 18 in 2019 and sort of just entered the criminal justice system. This number, though, however, remains very influential to this day in reports from advocacy groups like the ACLU and the Anti-Defamation League, and from reports or speeches by politicians. And these are all citing this number that was estimated more than 20 years ago now. But the context for this is that incarceration rates in the United States have actually been declining since 2007 nationally. But there's been some debate among scholars about the extent of this decline. So some have described this as a modest decline in incarceration, or concentrated among just a few states, whereas others have described this as the beginning of the end of mass incarceration. Really different ideas about what's happening here. And so my research question in this project was, how has the lifetime risk of incarceration in the United States changed over the last 20 years? And I'm going to do 3 different things to sort of assess this question. The first is just reevaluating these basic trends in incarceration rates and what's happened. The second is estimating the actual lifetime risk of incarceration for multiple cohorts. And then the third is comparing this to another life event that everybody in this room cares about, which is college graduation. So just starting off, looking at the incarceration rates, if you look at this figure, you might reasonably conclude that this was a modest decline in magnitude, right? So a 15% decline in the overall rate of incarceration over this period, 14% for white men, 17% for men overall, and about 26% for Hispanic men. Of course, there's one group missing here, which is black men, for whom the incarceration rate has actually declined by 44% from 1999 to 2019, and also in relative terms to white men. The disparity between black and white men in 1999 was about 9 to 1. In 2019, it was about 6 to 1. So there's been a decline both in absolute terms and in relative terms in incarceration for black men in this country, although the rate remains very high, and so do the disparities, of course. So given these declines, what is the actual lifetime risk of incarceration today, and how has it changed over the last 20 years? So to answer this question, I'm going to use a method called a life table. Why do we need to use life tables? So rates are telling us about the current prevalence of exposure in the population. Basically, what percentage of a given population is currently in a prison. Life tables, on the other hand, are estimating the lifetime risk of ever going to prison for individuals. So instead of focusing on the overall population, we're talking about individual level exposure and risk over a person's life. So the central question is, what percentage of individuals in a given cohort ever went to prison? And there's 2 different ways you can estimate this. The first is known as a real cohort, and the second is known as a synthetic. I'm just going to briefly cover those, but you can ask me more about that later if you're interested. A real cohort essentially is aging individuals through the actual trends of incarceration rates that occurred in their lifetime, and predicting or estimating basically what was the actual risk of incarceration for people born in a given year. So it's trying to follow a real group of actual people. A synthetic cohort, on the other hand, is a counterfactual scenario where you're asking, if the incarceration rates had remained stable, what would somebody's risk of incarceration have been, had those rates been stable? So if you've ever seen a life expectancy estimate, that's essentially a synthetic cohort estimate of how long a person would live if today's mortality rates lasted forever, right? It's the same idea. So we're going to start by looking at these real cohorts, again, real actual groups of people and what their actual risk of incarceration was, in this case by age 25. So this is among people who turned 25 in these years. So for black men who turned 25 in 2006, about 20% of them had been to prison by that point in their life. Just 13 years later, in 2019, about 12% of black men who were turning 25 in 2019 had been to prison. About a 40% reduction in the risk of incarceration in young adulthood in just 13 years. And you can see that this is declining every single year over this period, right? So being born just 1 year later was a significant reduction in the risk of going to prison in young adulthood. And these risk declines happened for all groups, but they were starkest among black men here. Next, we're going to look at synthetic cohort estimates and extend this further into life to age 38. So at approximately a lifetime risk of incarceration, because most people who've been to prison have gone before they've reached age 38. So for black men who were born in 1981, turned 18 in 1999, sort of at the peak of incarceration for black men in this country, about 36% of them would have gone to prison had those incarceration rates remained stable. Well, what's happened to individuals who were born in 2001, that same cohort we talked about before, and turned 18 in 2019? For that group of individuals, the risk of incarceration was essentially cut in half. And so if incarceration rates do not decline any further, if they remain at the 2019 levels, we expect that about 1 in 5 black men will be incarcerated by age 38. And again, that's absent any further declines. If incarceration rates continue to decline over the next years, as they have in the last 4 years, this risk of incarceration would actually be even lower than that. So basically, 1 in 3 became 1 in 5 in just 20 years. And if you compare these numbers and sort of do some back of the envelope calculations, what we estimate is that about 31,000 fewer black men from that single birth cohort won't go to prison in their lives because of these declines in the incarceration rate in the last 20 years. By comparison, there's about 34,000 total undergraduate and graduate students here at UAlbany right now. So basically, an equivalent number of black men from a single birth cohort. Maybe that number is wrong. I don't know. That's what Google told me. Does that seem right to people?
I think our administration would love that if that were true, but it might be a little bit.
That was on the website. I'll check with somebody else later.
That's why it's on the website.
Yeah. I think it was total enrollment or something. Anyway, so comparing this to college graduation, if we look at 2009 and 2019, for the overall population for men, for white men, and for Hispanic men, graduating college by age 25 was a far more common experience than going to prison in both 2009 and 2019. For black men, it's a very different story. In 2009, black men were more likely to have been to prison by age 25 than they were to have graduated college. Just 10 years later, however, this had completely reversed, and black men turning 25 in 2019 were more likely to graduate college than to go to prison. A really significant shift in early life course events in just 10 years, for people born just 10 years apart. So, just to briefly summarize, I think I'm good on time, but basically the risk of incarceration was cut in half for black men in just 20 years, a single generation. And this has already affected the lives of real cohorts of young men in this country and really recalibrated the institutional landscape for those men. The implications of this suggest that prisons will have a reduced role in reproducing inequality in the United States, and that fewer families and children in particular will be impacted. And that this should, to the extent that imprisonment has obscured our view of racial inequality in the United States, this reduction in imprisonment should give us a clearer view of racial inequality. So, thank you.